Hi everyone, I'm Dr. Arpan Wagre. I serve as Chief Medical Officer for Wellbeing Trust and have the pleasure of being joined by Supreme Laroque today. Thank you for joining us.
Ingredients, thank you.
So today we wanted to talk about depression and wanted to first get a sense from you, like, can you tell us a little bit about what's going on, what was going on with you and what you wanted to share?
First and foremost, I didn't realize that I was depressed. I knew something was going on because anything that I loved didn't make me happy. I'm an avid record collector, and I live for going out and looking for records and getting records in the mail, and they were arriving in the mail and I wouldn't even open them. My mail piled up for like 7 months before I even walked over to it. I'd just throw the packages down. Nothing got me excited. I just didn't feel good about anything.
Did somebody point it out to you that you were somewhat
I
different?
talked to a friend of mine and I told him, I was like, I'm not eating, I can't sleep. Nothing makes me happy. He's like, you're depressed.
And how did you react to that?
I just thought, I was like, am I? I questioned. I was like, am I? And then I Googled it, and every symptom was there. And I was like, he's right. He's completely right.
It's so true that most people who struggle with this, it's hard for us to recognize that something's not right. And maybe we have, a problem like depression, which is treatable. And you were lucky to have a friend who at least could pick up on that and share that with you, and be honest and start that conversation. So what did you do after that when you learned more about what was going on with you?
I thought that I should probably seek some kind of help at that point. And that's when I reached out to a counselor and I made the appointment. And even reaching out to him kind of rubbed me the wrong way because the first thing he asked was like, who's your insurance and all that. It seemed like he just was about making money or wanted money, and like he wasn't there just to help me. I wanted help, I need to talk about this. So even when I made the appointment, he didn't show up to the appointment, and so I never got the help,
Well, so did you then continue to struggle, or was there somebody else?
Oh yeah, I struggled. I started crying. I got really sad, I got suicidal. I was bad. I got really bad. And I cried like every day for like 6 months. Even at that point, I Googled what's the longest anybody's ever cried, because I was like, do I have the record for this right now? That's how I felt. I felt worthless. I just felt terrible. I wanted to die.
How did you cope with that then? How do you pull yourself out of that?
The thing that really honestly saved me was my 8-year-old, my son, because he just kept popping up in my head, and I'm like, he needs his dad. Like, I gotta get through this. There was nights I was ready to die. And I was like, so how am I gonna die? Like, I really thought about it.
I have so much respect for the fact that you are here and talking about this. This takes a lot of courage and can help so many other people who are suffering quietly actually have the courage to get help. Because, it's so common in men, particularly African American male and Hispanic men, not to get help. And the classic, you don't usually see symptoms of depression. It starts off with being maybe more withdrawn, losing interest in your hobbies. And those are hard to pick up on. And then you're either more irritable or more tired and just give up. And it starts affecting your quality of life. It affects your family life, affects your job. And then it gets to a point where it can become so serious that people think that there is no hope and you want to end your life. And it's so sad, but this is so common, and yet most people don't recognize this. So the fact that you're here, you're sharing your story, we're grateful. And I think this is hopefully a message for many younger people listening to this, that if they are struggling with something like this, that they stand up, they get the help, because these are treatable conditions. You know, these are things that people can get help. Your life can get better.
Right.
You don't need to suffer. You don't deserve to suffer. You deserve to feel better and get better.
I agree, and one thing I've learned is that, you know, people say nothing lasts forever, and I agree with that, even depression. You know, life is like this, you know, life has its ups and downs, and I'm thankful to be here today. You know, I'm glad I'm not depressed any longer. I guess it just sort of worked itself out for me over time. I think I was just surrounded by goodness, you know. I had positive people around me. I even reached out to like this girl that I don't even know her, but she's one of my Facebook friends, and she just seemed kind of depressed. I could see by her posts, like, and I asked her, and she's like, yeah, and like every morning she would text me something positive, and she helped me. It helped me a lot. I think that had a lot to do with it. And then talking to people, like you said, like we don't talk about this. You're just not supposed to talk about. I'm taught, you know, or society, you don't talk about your problems with people. It's your problem, not their problem. You don't need to talk about it. But I think you do need to talk about it because it helps. And you know, I definitely want to help, because what I didn't realize was talking to people helped. They went through it too, or they were going through it at the same time, you know?
No, you're so right. Just starting that conversation, normalizing the conversation is so important. Being able to show up for each other, this is what we're about, and we do that. It has a huge impact on people. So the fact that you know, after you went through your struggle, or when you were going through that, you were still trying to look out for other people and talk to them. And you know, the more we have the ability to watch for this among our neighbors, friends, and talk to people, we can help each other.
I agree.
Yeah,
totally.
You know, people don't realize how common depression is. Worldwide, depression is the leading cause of disability worldwide. In the United States, about 19 million people suffer from a depressive illness every year. That's about 6.9% of the population. Very, very common and very treatable. Yet, like you said, there's such a stigma. We don't want to talk about this. We don't want to get help, and and many times we don't even recognize what's going on.
I was going to say, because initially, like I said, I didn't recognize. All I knew is I'm not happy, and nothing does anything for me. Like,
it's so true. And then how did your friends, you said your friends and noticed, and they talked to you about it. You mentioned that there were some people who, you know, were more supportive. How did you feel like your family and friends reached out and actually made things better for you, and how did they support you? Were there certain things that people said that actually made you feel better in that moment?
Sometimes. Yeah, I mean, everybody just telling me, oh, you know, you're going to get over it. You're going to laugh about this, you know, down the line and all this. And you know, when you're in that, when your mind state is there, when you're in it, nothing matters what anybody says. You know, I was telling you earlier about it takes like Anthony Bourdain or Robin Williams or Kate Spade or somebody to commit suicide to get the conversation going, for people to talk about it. And you got to think about the three people I just mentioned. They were at the top of their game,
right,
in what they do. And for them to take their life, or want to take their life, you got to think how bad it was for them.
Yeah. You know, you're so right. You know, you think about this and you talk about suicide, and people still say, you know, you commit suicide, but you die from cancer or die from heart disease, as though this is a choice. And when you think about it and you reflect, you say, well, is this really a choice? You know, the analogy I like, there's a person by name David Covington who uses this analogy and says, you know, I was hanging from a high cliff. So thinking you're hanging from a very high cliff, and you don't want to let go, because if you let go, you know that there are rocks down there, you're going to fall down, you're going to crush you're guaranteed to die. You're holding on to that with everything you have, but fatigue, gravity, pain get the better of you. And it hurts, and at some point in time you let go. And that's the end. And that is similar to what suicide is. So is suicide really a choice? Or are we in so much emotional distress and so much emotional pain that that's the only option at that point in time for people? And how do we get ahead of that? How do we help you before? You know, it was unfortunate to hear that you tried to get help, but that help wasn't there for
Right.
you. I want people to realize that there is help. I mean, you don't need to suffer for somebody else's incompetence. You deserve to get better, and you don't need to go through those long episodes of depression where your quality of life is getting better. You were lucky that you had family and friends and were able to speak with them, but was there any other professional you were able to reach after that didn't work out with the first person?
I just didn't at that point.
didn't
I
point,
just
okay.
chose to deal with it, honestly. And, you know, thinking back on it, I realized that no one is immune from this, and that I was in a space that I never thought I would be in. I was fine up until I got there, you know? And I couldn't believe when I was going through it, like, this is happening to me right now. And then it made me realize this can happen to anybody. And probably does. You know, we're all humans. I'm sure everybody goes through something. And whatever it is that triggers it, what I don't know, you know, it's different things. But it made me realize that, you know, you get the flu, you get sick, or you get a cold, your brain gets sick too. Your brain can get sick just like the rest of your body.
Yeah, you're absolutely right. And we have different coping mechanisms. Did music, since music is such a big part of your life, did music help you? Was that something that was a good?
Not especially.
especially.
You know, most times it does, but during that time, like I said, I was bad. Nothing did anything for me.
Wow. You know, it breaks my heart to hear that when, you know, when these are conditions, like, you know, we have done so much in the medical world. We can transplant a heart to save somebody's life, and yet something so common as depression that's so treatable is just not available to everyone. The care is not available. We're not able to help people when they need the help the most. And it just takes away that chapter of your life, that time in your life. The quality is gone. But there is hope. I don't want anyone hearing to feel, you know, this conversation to feel that they need to suffer alone. And things, you know, things will get better, things can get better, and there's help. And, you know, I was wondering how it is in the music industry. Is this something that you find that's fairly common? People struggle with it?
Yes, most definitely. I just saw an article last week talking about a lot of musicians. I don't know if artists in general, but they were saying a lot of musicians, a high percentage that suffer with this.
Do they seek help or self-medicate with?
I'm not sure. I didn't see all that.
Yeah. No, it's hard, and you know, a lot of times people don't seek help, but they're suffering, so they need something,
Right.
and they tend to self-medicate with alcohol or other drugs of abuse, and it kind of gets them through that day, but unfortunately doesn't take care of the problem and adds one more problem to.
And speaking of that, like, I was like, you know, I try to help myself. Like, I got to get out of this, and so I was doing everything from like putting a diffuser in my room and making it smell good, like just little things like that. Like any little thing I could do, I was doing, and it actually helps.
I love that. Yeah, I
Like,
love the way you were thinking about that. Yeah.
I was like, I was reading stuff, and I was like, you know, any little thing I could do to get out of it, because I knew I didn't want to be there.
Yeah.
I mean, I'd be driving home after, you know, DJing all night, and I would picture or imagine I could just drive into a pool right now and just kill myself and be done. And I wanted to. I felt like I wanted to. You know, and I'd start crying, and you know.
The 8-year-old son. Those are
Yeah.
positive. Yeah.
Yeah.
No, but I really love the way you started. You know, you thought about little things. I think this is so important. I mean, little things. We all should do that.
No,
We should,
little
you know,
things, meditation, and
Yeah.
all kinds of stuff. Like, and, you know, I always read about self-love and self-care and all this, and it's so important. You know, and it took me to this point to realize that.
Sometimes it's, you know, exercising. just getting on a
Even
routine.
eating right.
Even eating right.
Like then I
Exactly,
lost a
yeah.
lot of weight.
Yeah.
I wasn't eating at all when I was depressed. And then started getting better, started eating right. You know, I started walking every day and riding my bike. I was kayaking. I was doing all the stuff that I didn't really do. And like I remember I posted a picture of me kayaking and everybody was tripping. Like, what are you doing? Like,
Yeah.
they just didn't expect it out of me.
It's hard though. When you're depressed, you tend to become more withdrawn. The more withdrawn you are, the more depressed you stay. So it's like the chicken and the egg, and you need to break that cycle. And you know, I think the little things you did were amazing. I mean, just getting back on a routine, exercising. You kind of have to fake it till you make it. And then once you start exercising routinely, you start getting some physical exercise, healthy diet, doing little things that you previously brought you joy in your life. If you spend more time doing that, like you withdrew from music, and sometimes you're going to have to force yourself to do things that you previously enjoyed, and it kind of gently gets you back there. But this is not a substitute for getting care. I mean, sometimes we feel down, we have bad days, we're a little depressed, and sometimes we have clinical depression,
Right.
which is different, which is a true medical condition that requires medical attention. And there are a lot of treatments. I mean, there's talk therapy. There are all kinds of different talk therapy that can help people get better. There are medications that are safe, that could be used for a period of time, get people out of that depression. There are different things that can be done. And there's, for Seattle, where we live, it's gray and gloomy a lot. People have seasonal depression, and using a light box helps.
Yeah, I've heard that.
There are things that we can all do.
I have another friend that's, he has anxiety and stuff, and I stopped by to see him, and he had a light box, and he's like, oh, my doctor says I need this light box.
Yeah, and it works really well for some people. So, what I would say is that sometimes when we're going through this, it's hard. How do you navigate this? So I think you did all the right things. Your friends were able to kind of help you identify that. I do think that speaking with your primary care doctor is probably a good first step, because sometimes they can help navigate this for people. They can help you get connected to the right level of care, because it's hard. It could be you want to rule out other medical things as well. Sometimes people have thyroid problems that makes them depressed, and other things. They need to make sure you're doing well medically.
Right.
And like you said earlier, I mean, this is just like you think about any other medical illness. That's the same thing. And so
kidney failure and all kinds of stuff. Like, your brain gets sick.
Your brain gets sick.
No one's immune.
Right. And that's that's another really important thing. You cited the examples of 3 celebrities who were supposedly at that top point in their career, right? They're at
the top.
And yet, anyone. So depression can set in at so it could be any race, any age. Doesn't matter what your socioeconomic status is. Doesn't matter where you are. It can happen to any of us.
Right.
And I think it's important for us to recognize that. The other thing is, like, what causes depression, right? So there are different things. There's genetics, there's a biological cause, but then there's psychological reasons, ways of thinking, and then there's social things. People can have, financial stressors, problems with, relationships. There's so many things that come in, and they can, make you go through a depressive episode.
Or a little bit of all of those.
And that's
time.
that's probably what happens in most cases. It's that complex interaction, and then and then chronic illnesses. I mean, people tend to not pay attention to that. You say you have pain. Okay, you have pain. Pain can make you depressed, but if you have depression, depression can make your pain worse. And so they make each other worse. And it's important. Like, you have heart disease. That in itself can make you have depression. And you have depression, it puts you at a greater risk for having certain heart conditions. So it's not something that we should brush off as though it's benign and doesn't count. It is important, and I think paying close attention to that is and getting help in a timely way is really, really essential.
Right.
Yeah.
I know I just try to stay busy, during those times, and I realized, hey, I'm okay. But like I said, it was the moment I stopped, like when I was driving home by myself, and then my mind started racing, and then it would hit me hard. But I noticed when I was busy, I wasn't thinking, I didn't have time to think about it. But sometimes I couldn't help myself. There'd be times where I'm DJing, I'm in a nightclub full of people, and I would start crying. And I would hide it, because I'm like, these people can't see me this way. I'd pretend to go to the bathroom, and I'd go in there and cry for 10 minutes. I'd put a long song on and then run back. And It was difficult.
Yeah, and if you say had high blood pressure or diabetes and you were struggling with something like that, would you have dealt with it the same way? Or, because it's depression, we don't want to talk to anyone about it, because people judge us.
Yeah, right.
Right?
No, I wouldn't have. I would deal with that totally
differently, right? Yeah. No, it is. Yeah, but the fact that you're here, you're sharing your story. What got you to that point that you said, you know what, I'm going to go out there and I'm going to tell people? What was that point that made you?
Realizing that I did get better.
Yeah.
I'm glad I didn't commit suicide. And I was like, I got to talk to people about this, because why not? I think it's a myth that don't talk about your problems. And I'm like, no, talk about them.
Yeah.
Like, for me, it's therapy. I mean, for me, I like talking about it now and getting it out. It makes me feel good. And if I can help someone, I definitely want to help somebody.
You definitely are.
We're not.
You're helping people with this.
Like you said, like, we're not alone in this. Like, if somebody feels alone, they are not alone in this.
They're not alone. Yeah. And I think you're
and
so right.
And you do feel alone when you're in that mind state. It's terrible.
We need to show up for each other. We need to be able to have that conversation. Just normalize the conversation. I think there's so many little things that we can do, like school-based programs, starting off with younger kids. There's such a stigma that people, don't want to talk about this stuff. But how do you get ahead of it, right? So, talking about it in schools. If people need help, it doesn't, there are all kinds of myths, right? You say that if you're depressed, then you're going to always stay depressed. Or, you're going to be put on some medications that you can't ever come. But that's really not the truth. There are different types of treatments based on what's going on. And people can get better, like you've seen, through your journey. Now, the only thing would be that why do we have to allow people to suffer for so long? Why can't we help them sooner so that they don't go through that prolonged period? Another thing is that depression, comes in, it's a cyclical illness. And so you might get completely better. And it's important to watch out for the warning signs early. And if that were to come again, that you're getting help earlier on and not letting, that whole...
I mean, it's funny you bring that up. Even now, I'm like, like I said, I'm over it and I feel great. But in the back of my mind, I'm like, am I going to go back to that place any day here? Like,
I've had so many people I treated tell me that they would any day take a broken arm, broken leg over a deep depressive episode. And they tell me that, well, at least people can see this physical injury and they can empathize with me, they can sympathize with me. And when I was suffering with that deep depressive episode, nobody could see my pain and I was in so much emotional distress.
So when I was going through it, it was funny because I don't know why, but I smiled a lot more at this point. I was at my worst, but I was smiling more. I think that's just the way I was dealing with it. I was kind of trying to hide it, I think, from people. And people were saying, man, we've never seen you so happy, man. And I said, oh, man, I'm dying inside. I had somebody come through, I've never seen you so happy. I said, I'm dying inside. And she was like, oh, come on. And I'm like, and I was. I really seriously was. But, I just think I was masking it. Yeah. And then even the other day, someone said they heard some people talking and someone said they were depressed and they said, oh, what? You don't look depressed. I'm like, well, how are you supposed to look? How does depression look? You know what I'm saying? They're supposed to be like Eeyore from Winnie the Pooh, like walking around with their head down or something. I'm like you said, if we don't let you know, you don't know. You don't know that what's going on with somebody.
That's such an important point. It's such an important point. Everyone presents differently with depression too. And depression is not the same. It's, everyone, there are sometimes people who are just more irritable. And you don't see the classic symptoms where they're sad or depressed and they're just irritable, they're tired all the time. And that could very well be a sign of depression. And I think understanding and doing a careful assessment is important. And I think you're so right. Like, what does depression look like? It looks like different things for different people at times. But I think recognizing some of those warning signs are really important. If people are withdrawing, they're becoming more fit, they stop doing things you previously enjoyed. That's a warning sign. A lot of elderly patients, I used to work in an elderly clinic, a geriatric clinic, and sometimes people would say, well, I'm old and all this is happening, it's probably okay to be depressed. No, it's not okay to be depressed. It's not okay to be depressed if you're young or you're old or anyone. I mean, these are medical conditions that need to be addressed and treated. And understanding what kind of things bring you joy and making sure that that's a part of your life. But those are some of the first things to go away. You stop doing things that bring you joy.
Anything that brought me joy brought me nothing. I didn't care anymore.
And that's a warning sign.
Like,
that's
at
something we want to
all.
watch out for, right? And then sleep. People either have difficulty falling asleep, or then they sleep and they wake up very early in the morning and they're not able to go back to sleep. They're very tired all day.
Yeah.
Your appetite could go down or increase. It could
Right.
happen either way. You just sometimes people feel excessively guilty. They think that it's their fault. And then you start feeling hopeless, helpless.
Yeah.
These are very classic symptoms that we should watch out for, and this is what tells you that you're depressed and need to get help.
Yeah, I felt, less than zero, like a waste of space. Like, why am I even here?
I know this is hard, but you've come to the other side, and now you're
Right.
seeing it differently.
Oh, totally.
Yeah. How would you advise younger people or other men who would otherwise consider this something that they would never talk about? Like, are there some things that helped you start talking about this?
The only thing that really started me talking about it was getting over it. And then at that point, I realized this needs to be talked about. Like, this isn't just happening with me. And like you said, all ages, it's something that needs to be talked about. The only thing I can really say is you're not alone. And as helpless as you feel, things do get better. You will get over things. Now, when you're in that mind state, you're not going to think that way. Or you're not going to think it's ever going to get better.
But it does get better.
But it does. So stick it out and do what you need to do to make it better.
Well,
Whatever that is.
I am so grateful for your taking the time, coming here to talk to us and sharing your story and instilling hope in people, telling people that there is hope. So thank you so much.
Yes, thank you.
Yeah.